Hi everyone, my name is Dixie Wheeler and I'm a graduate student at Texas A&M University, Corpus Christi. I'm currently enrolled in the Family Nurse Practitioner program. I want to take the time to thank each of you for taking the time to view my presentation. This presentation is based on the integrative systematic review of literature that I have performed this semester to determine whether the utilization of standardized feeding protocols can prevent necrotizing enterocolitis in very low birth weight premature infants. The PICO question that I use to guide my research is, in very low birth weight premature infants, does utilization of a standardized feeding protocol that provides guidelines on early initiation and slow advancement of feeds compared to variations in practice on initiation and advancement lead to less occurrence of necrotizing enterocolitis? First, let me define some of these terms in case you're not familiar with them. Necrotizing enterocolitis, or NEC, is defined as a gastrointestinal disorder that is diagnosed based on signs of feeding intolerance, blood in stool, and abnormal abdominal radiology that suggests the presence of pneumoperitoneum or pneumatosis intestinalis. Very low birth weight infants are infants that weigh less than or equal to 1,500 grams at birth. Premature infants are infants born before 37 weeks of pregnancy. Standardized feeding protocols are set guidelines that standardize initiation and advancement of enteral feeds. Necrotizing enterocolitis causes a significant number of deaths among neonates in the neonatal intensive care unit. Significant variations of practice exist on feed initiation, feed advancements, and management of feeding intolerance in very low birth weight infants. Standardized feeding protocols have been suggested, but with varying results. Variation in practice should be minimized, and an evidence-based approach should be determined. So why is this an important topic that needs to be addressed? The consequences of not solving the problem are significant. The incidence of necrotizing enterocolitis increases with the decrease in infants' birth weight and gestational age. The only identified risk factor associated with NEC is prematurity. The mortality rate of NEC for extremely premature infants is 40 to 100%. Most NEC cases are treated with medical intervention. However, 20 to 40% of infants require emergency surgery. Of the infants who survive, about 50% develop long-term complications, including intestinal stricture, short gut syndrome, impaired growth, prolonged hospitalization, and parenteral nutrition-associated cholestasis. Necrotizing enterocolitis accounts for nearly 20% of the annual NICU costs and approximately $5 billion per year for U.S. hospitalizations. Before starting my research for studies, I used the following inclusion criteria: primary research that evaluates the effects of standardized feeding protocol on the incidence of necrotizing enterocolitis, studies that use the population of very low birth weight premature infants, studies that are written in the English language, and studies that were published between 2007 to 2017. The following were my exclusion criteria: studies that include very low birth weight infants with comorbidities that increase the incidence of NEC, including major congenital abnormalities and known gastrointestinal abnormalities, and studies that receive a quality appraisal score of less than 3.5 using the Quality Appraisal Review Checklist. I used necrotizing enterocolitis and feeding for my search terms. I used both CINAHL and PubMed for my databases. In the CINAHL database, there were 290 hits when my search terms were entered. One study was excluded for not being written in English, 96 were excluded for not providing full text, 143 were excluded for not involving very low birth weight infants, and 3 studies were excluded for involving very low birth weight infants with comorbidities. In the PubMed database, 648 hits resulted from my search terms. 17 studies were excluded for not being written in English, 436 articles were excluded for not providing full text, 136 articles were excluded for not involving very low birth weight infants, and 4 repeat studies were excluded. 13 articles met the inclusion criteria, but 6 were determined to be appropriate for this review. 4 out of the 5 articles that investigated effects of a standardized feeding protocol on the incidence of NEC suggests that this intervention can decrease the incidence of NEC. One of the studies found that there was no difference in the incidence of necrotizing enterocolitis with the implementation of standardized feeding protocols. One study found that there is no difference in the incidence of NEC when a slow approach feeding protocol, which consists of 20 mLs per kilo per day of enteral feeds, versus a fast approach, which is 30 mLs per kilo per day, is implemented. While another study had an unexpected finding that the incidence of NEC increased with the use of parenteral nutrition. The evidence that has been found has shown that a standardized feeding protocol is important in decreasing the incidence of necrotizing enterocolitis in very low birth weight premature infants. The results shown in the evidence table confirm that there is conflicting evidence for slow versus rapid feeding advancement standardized feeding protocols. There is strong supportive evidence for early initiation of enteral feeds in this population. It is recommended that all neonatal intensive care units implement a standardized enteral feeding protocol that includes early initiation of enteral feeds within the first day of life for very low birth weight premature infants to decrease their risk of necrotizing enterocolitis. However, no recommendations can be made on whether the feeding protocol should follow a slow or rapid feeding volume advancement due to the conflicting evidence. More studies should be conducted that investigate slow versus rapid standardized feeding protocols and their effects on the incidence of NEC. Preferably, more randomized controlled trials and quasi-experimental trials should be performed